Welcome, everyone. Thank you for joining us. I am so excited to be introducing you this evening to Mira here at Solseri. She is the RN. She's a registered nurse, and she's been with us for almost a year now. And Mira, you will see very quickly why I love her so much and feel so lucky that she's here with us. She is just absolutely dedicated not only to patients, but also to continuing to learn more and more and more about IV therapy, about supporting our patients with dementia, about supporting people through functional medicine. And she's in fact like applied for to become a nurse practitioner and to take on even more responsibility. The more time I spend with Mira, the more I love her. And I hear the same thing from patients. She's also, when we talk about IVs, most importantly, she's a really, really great stick. Everybody wants Mira to be the one who starts their IV or does their blood draw. And so I can't wait for her to share her expertise and everything she's learned. She's often sharing with me the patient's responses, and it's just really fun and exciting for me to get to introduce you to her. She's going to spend about 25 minutes going through some of the IVs that we offer, particularly the immune IV and what we've seen with that, with cold and flu season, with COVID, with a few things. And then she'll also open it up to questions. So Mira, I will let you take it away, and I will be available in the chat for question and answers while you are presenting. So feel free to put your questions in the chat or in the Q&A, and I'll be here to answer them.
All right. Thank you so much, Dr. Sanderson. Can y'all hear me well? All right. And is my screen okay? All right. Perfect. All right. So let's just get started here. So first off, we just want to introduce ourselves, our team. We are called Solseri. As a lot of you all know, we specialize in brain health and as well as just like overall like wellness, well-being. We're here to, take care of you. We know that your body is very resilient, and then we're here to just kind of give you a little bit of that push, that assistance. And then a bunch of all of you already know who we are, so I'm not gonna waste my time on all of that. So yeah, let's just get started. All right. So I know a lot of you are already familiar with like hydration clinics, vitamin IV clinics. I know a lot of them have been popping up everywhere. So I just wanted to, go into this really quick, just to give you a little bit of a rundown on what makes our clinic, what makes Solseri different from all these other hydration places that a lot of you are probably already aware of. So first off, of course, the quality and the quantity of our compounds. We source our medications directly from compounding pharmacies from all over the country who have done extensive quality control check and with a certificate of authenticity. And then, of course, me personally, going through all these medications and compounded substances myself, I also do my own background check, and I work directly with these pharmacies. So we know that we are infusing you with like high quality products. And of course, lucky for us, we can also confidently say that, Dr. Sanderson has over a decade of experience formulating like nutrient IVs based on the latest neuroscience. And we apply her expertise into our immune IV, which is formulated to be the highest quality available. So you can be confident that while you're dripping here, you are receiving the best quality in the amount that your body actually needs. All right. And of course, we pride in quality of care. For me, it's not just about giving you a stick, giving you a poke, dripping the bag, and then just letting you infuse like, in the lounge area. For me, it's more about how is it affecting you? Is it even, are you experiencing any of the benefits of these IVs? How can we adjust based on your needs, which also goes down to personalized care. So a lot of our IVs, as let's face it, everybody's different. What may work for one person may not work for the other. So here we also pride in personalized care. So if ever you're here getting any of our IVs, specifically our immune IV, if there's any like symptom or anything that you're feeling that is a little bit off, of course, I will let the doctor know, and then we can adjust the formulation of your IV bags from there. So that's what makes us different from the rest of what everyone else knows as those hydration clinics. So for our agenda for today, um, we are just going to go a brief introduction here, and then we're gonna, dive right into giving you more information on what an IV therapy is, what are the benefits of getting this treatment, and has it actually helped any of our patients? And spoiler alert, yes, it actually has helped a lot of our patients, battling numerous numbers of conditions, not just like one specific thing, but it has helped a lot of people with different kinds of ailments that they face on a day-to-day. So, and also at the end of this video, we will have just a special offer just for you, just for tuning in today. All right, so let's get started. So my name is Mira Aguilar, and I am the IV nurse and lab manager here at Solsari. I am a board certified registered nurse in the state of California. And currently, I am an active member of the Holistic Nurses Association, the Association for Vascular Access, as well as the Infusion Nurses Society. So these groups have been very helpful for me in like keeping up to date and, knowing what the trends are and applying it into the patients that I see on a day-to-day basis. All right. And then I also received my bachelor's in nursing in the Philippines and received my US training here at Loma Linda University. I have been practicing for about 5 years now, primarily in outpatient surgery with a focus on GI. And I know a lot of people ask me like how I got into this field with like a background that is the exact opposite of what I'm doing now. I know what I'm used to is like more of like a fast-paced environment. And I know that back then I would be helping a lot more people, like of course, outpatient surgery, we're talking about volume. But for me, it just felt like I didn't make that much of an impact back then as what I'm doing now here at Solsari. I feel like what I do now here is more personalized, it's more personable with the patient, and it actually gives me a chance to establish rapport with each patient that I see. So for me, it's a lot more meaningful than, just the basic day in, day out in outpatient surgery setting. And of course, I've always been into the natural processes. It's something that I apply into my everyday life. It's a lifestyle that I try to follow. I love nature's healing properties. I love going out on hikes, just being outdoors, and then just feeling like, that nature really is powerful. There's something that we can't really comprehend much, but there is a science behind it. So that's why I'm here, and I'm learning so much every day. And being here at Solsari, it has really helped me shaped my career into kind of like this drive that I have with natural processes. And with that being said, fast forwarding into the future, as Dr. Sanderson mentioned, I'm currently entering school again to get my master's and become a family nurse practitioner, so that I'll hopefully be able to have more autonomy in fulfilling my purpose for each and every one of you. All right, so let's dive right in. So really quick, I want you all to just briefly, think to yourself, or you can put it into the chat, whichever way you like. Just, what is your understanding of what an IV therapy is? What do you know about it? Have you gotten it before? Do you know anyone who's gotten it before? And what have you experienced with an IV therapy? All right. So just, give yourself a few seconds, just, tell yourself, what do you think what an IV therapy is? All right. All right. So IV therapy. So IV stands for intravenous. Intra meaning inside, and venous pertaining to the veins. So it is an administration of nutrients and fluids directly into the bloodstream via the veins. It is also considered an invasive procedure that enables nutrients to access the body faster and in a much quicker rate as well into the circulatory system. This bypasses the gastric system so that the body can take on more fluids and at a much quicker rate too. So really quick here, I'm just going to go over the physiology of what happens in our body anytime that we take anything orally versus if we are to, get an IV. So in this photo that you see here, this is basically our gastric system. So I'm just going to go over really quick why is it such a big deal that the getting an IV therapy, it bypasses the gastric system. So in here you'll see a photo of the liver, your stomach, and then your small and large intestine. So in pharmacology, there is this something that we call the first pass phenomenon or the first pass metabolism. It is the phenomenon of the drug metabolism where the concentration of the drug is reduced before it reaches into the circulatory system. This is mainly associated with the liver since the main site of the drug metabolism happens in the liver. So after a supplement or medication is swallowed, it is absorbed into the digestive system and it enters into the hepatic portal system. Hepatic meaning the liver. So it is carried into the portal vein and it reaches into the liver. And then that's where these drugs and, supplements, vitamins are being metabolized before it reaches into the systemic circulation. So anytime it has to go through the liver, it directly reduces the bioavailability of that drug or of that supplement. So you're not really getting 100% of the active drug than you think that you are or you were. And oftentimes as well, when traveling through the body, not only does it reduce the bioavailability, but these nutrients may also be diverted and prevented from reaching their intended targets for any number of reasons. So that's what happens anytime we take anything orally. Whereas comparing it into the circulatory system, meaning if you're getting an IV, in this photo, this is focused more on our systemic circulation, where the blue lines are actually the veins and the reds are the arteries. And then closer here is a more up close photo of what the vein actually looks like. So this is where we insert the needle and insert the catheter, and then that's where we will infuse the fluids. So when doing an IV therapy, on the other hand, it goes directly into the bloodstream. It works with it works in your body at the cellular level, meaning you're actually getting 100% of this vitamins, drugs, nutrients, 100% of their bioavailability compared to if you were just taking it orally. So if you're struggling with your digestive system, getting an IV therapy will actually be very beneficial for you because this will give your digestive organs a break, and it will also allow you to get 100% of that active drugs bioavailability. Okay, and I hope that made sense. All right. So, and also just keep in mind, I just wanted everyone here to know that here at Solsari, we actually offer a number or a numerous amount of IV therapies. It's just that for tonight, we're just going to be focusing more on our immune IV because this is something that was formulated by Dr. Sanderson. So it is something more personable to us, to our clinic. And it's our most robust IV. And it's not just focused on one ailment. It actually helps a lot of different ailments that I've seen from patients coming in and coming out day to day. So our immune IV therapy, this is actually a medical treatment by which sterile solutions of immune boosting nutrients, such as zinc, vitamin C, lysine, B vitamins, and other naturally occurring nutritive substances are infused to assist with, repletion of deficient states. It causes disease modification, and it also helps enhance the cellular process. If you're familiar with the NAD IV, we actually prefer patients getting the immune IV first and then the NAD IV, because this kind of helps kind of like warm up our cells for the symptoms that we feel during an NAD infusion. So our immune IV therapy has all the support that you need to stay strong, and it is an excellent way to receive vitamins, minerals, and amino acids to more effectively nourish and rebuild your body. All right. So here's the good stuff. So what is exactly in our immune IV? I know we talk about immune IV, hydration IV, but what is exactly in it? So this is what we're going to be talking about for the rest of this webinar. So of course, we have vitamins, minerals, and amino acids in it. So first of our vitamins, we have ascorbic acid. Ascorbic acid, also known as vitamin C, this is found in a lot of our citrus fruits. And actually, fun fact, bell peppers have more concentrate of vitamin C than citrus fruits actually does. So keep that in mind. So vitamin C, why do we put this in our immune IV? Our body actually needs vitamin C to form blood vessels, cartilage, muscle, and collagen in bones. It is also vital in our body's healing process. And of course, it is the most effective nutrients in treating common coughs and common colds. So a lot of our patients coming in here to get an immune IV, it's mostly because they're coming in from like, an illness, the flu, or just trying to prevent it from, getting into their system. Next, we have our B vitamins. So specifically for this one, we use B1, B2, B3, B5, as well as B12. For B12, we typically give that as push. So vitamin Bs, they're known as the building blocks of a healthy body. They have a direct impact on our energy levels. So that's why a lot of our patients also tend to feel a little bit more energetic, just overall feeling better than when they came in after the immune IV. It also helps in brain function as well as cellular metabolism. Each B vitamin also has a unique and crucial role. So because they have a unique and crucial role, you can expect that vitamin B complex does everything from like boosting brain function to supporting a healthy immune system as well. Next, we have our calcium. So calcium, we all know the major function of calcium is to build and maintain healthy bones and teeth. However, it is also involved in much of the body's enzyme activity, as well as regulation of cardiovascular function. It is one of the most abundant minerals. It is involved in numerous vital functions such as proteins and fat digestion and regulation of enzyme activities, as I had just mentioned, and energy production, nerve transmission, neuromuscular activity, and the absorption of other nutrients such as vitamin B12. So everything that we put in this IV bag, they all go hand in hand. Next of our minerals, we have magnesium. So magnesium is actually an essential electrolyte and mineral, and it keeps our nerves, our muscles, and bones very healthy. It also helps in protein synthesis and cellular metabolism as well. It is also vital in sustaining a normal heartbeat, and it is used by a lot of doctors to treat heart rhythm irregularities. All right. And next we have zinc. So zinc is a mineral that is essential for many of the body's normal functions and systems, including, boosting our immune system. It aids in wound healing, blood clotting, thyroid function especially, and a sense of taste and smell. It helps the cells grow and divide, and it is necessary in the activity of enzymes, proteins, as well as DNA. All right, so that is our vitamins and minerals. The next topic we're going to be talking about is going to be our amino acids, so which are, as we all know, amino acids are the building blocks of life. They form the building components of protein, and it is a vital component of every cell in our body. They help improve digestion, strengthen immunity, and promote bone health as well. It also boosts memory, controls brain function, and mood. So first of our amino acids, we have lysine. So lysine is actually a critical amino acid that is involved in muscle development and growth, as well as the production of various hormones and antibodies needed for proper metabolic function and defense. Next, we have our glycine. So glycine, the best known role of glycine is its participation in collagen synthesis. It helps in healing and regeneration of the skin. So definitely wound healing plays a big part of that as well. Other benefits of glycine include fighting against cardiovascular disease, blood sugar control, muscle protection, and the reduction of cortisol levels in the blood. So that's why also a lot of our patients, not only does it kind of boost their energy, it also gives them this sense of calm after they receive our immune IV. All righty. And next we have taurine. So taurine, actually, research to date suggests that taurine helps in boosting exercise outputs, as well as assisting with recovery and positively influencing the cardiovascular system. It has also shown promising results as a potential to aid in several other chronic conditions, such as obesity and diabetes. All right. And last but not the least, we have carnitine in our amino acids. So the primary function of carnitine, or what it's known for, is in facilitating the transport of fatty acids into cellular mitochondria, where it can be burned for essential fuel. So this has actually been popular for weight loss, carnitine. But the most impressive benefits of carnitine include its impact on heart health, as well as the brain function, bodybuilding, among others. And lastly, we have glutathione. So glutathione is not actually an amino acid. It is our body's chief antioxidant. We typically give this as a push. I love glutathione myself. And because it just promotes like proper detoxification in our body and just gets rid of any like toxic exposures that we may have, because sometimes our body just needs that little like push to like help in detoxing. So yeah, and as an antioxidant, glutathione plays like several roles in the body. It is also involved in tissue building, repair, and the production of enzymes and hormones. It also plays a key role in the immune system as well. So lots of good stuff that we put in each of our immune bags, as you can see. All right. So next, we're going to go over the benefits. So sometimes even with great diet and supplements, we can't always provide our bodies with optimal amounts of vitamins and minerals on a cellular level. So the immune IV therapy enables cells to get the vitamins and minerals needed to function optimally and to heal as well. So this therapy enhances the healing process. It alleviates many physical ailments. It helps restore energy and stamina. And it also has a long track record of healing a myriad of medical conditions. So it's not just specific on just like one condition. So it has helped a whole lot of patients battling with different kinds of conditions. Patients commonly seek our immune IV when trying to heal from common colds, serious illnesses, or like just like coming in and out of surgery as well, because it does have that wound healing properties in it, such as the zinc and the glycine. So yeah, and our immune IV also helps people who are seeking to just like basically feel more energetic, boost overall health. What else? Prevent diseases, illnesses, improve physical endurance, as I had already mentioned, boost the immune system, heal from injuries, just overall boost their mood, improve mental sharpness and cognition, as well as alertness, and reduce fatigue, reduce body pain, and reduce side effects from common cancer treatments such as chemotherapy. All right. So what else is it good for? So I know a lot of our diseases or our common chief complaints, you know, essentially all of them, not all of them, but most of them happens like or starts from the gut. So when our gut is not functioning properly, it kind of has a domino effect on our brain and our neurological function as well. So anytime that our gut is going through something, our mood kind of depletes, like we get foggy brain, we have a hard time concentrating. So this immune IV will be especially good for that as well. So with our gastrointestinal system, because we're dealing with something in the gut, we are more prone to infections, whether it's viral or bacterial. And then when we get these infections, our body goes into this inflammatory process. Then we end up getting skin disease. We're more prone to allergies. We're also like, go into like malnutrition, we get nausea, and then eventually we get dehydrated. And when all of these happen, it has a direct effect on our brain and our cognitive function. So then we end up getting chronic fatigue. We get more susceptible to mold and other toxin exposures, and migraine headaches, definitely insomnia. And for most people, they also just use this to maintain overall health and well-being, for recovery and performance, and immunity booster, to just boost their immune system. If they're going to surgery, they seek our immune IV, or for patients that are going through chemotherapy. This is especially if they're getting high doses of ascorbic acid or vitamin C. All right, so our success stories. This is my favorite part. We do have this patient. I'll name her Stephanie. So Stephanie came in here when I first started here. She was probably just in her first or second immune IV therapy. When I first met her, she has a whole lot of symptoms that she deals with. Mainly she has arthritis. So her body's always going into this like process of like inflammation. And of course, when our body is going through this process of inflammation, like everything else gets affected, our mood, our eating habits, we end up gaining weight, and then we just essentially end up being all crabby. So when I first met Stephanie, she was all of that. She was just like not in a good mood. There's always something wrong. There's always something to complain about. And then eventually, after like the fourth therapy that I had with her, I noticed there was a great improvement in her mood. She was a lot more talkative, sharing a lot more with like, what she did over the weekend, whereas before she would barely talk to me. She just wanted to get this therapy over with. And then after some time, I did see, a great improvement in her mood, as well as just like her overall presence in the clinic. And then after probably the sixth or the eighth treatment, she felt like she was doing so much better. She was doing this immune IV therapy once a week. And then eventually we brought it down to every other week. And, of course, in the beginning, this has to be something that you want to maintain, and then essentially kind of like lower down the therapy or the treatment to like every other week. And then eventually she did it once a month, and now she's just doing so much better. She's out there paddle boarding, going on hikes with her dogs. And yeah, it's just crazy for me to see how like someone, it was just like a generally unhappy person to like all of a sudden this very active, productive person, just from like a couple months of getting this immune IV therapy. So definitely something for everyone to think about, whether we're battling specific ailments or not. It's definitely going to be for everybody. All right, so because you guys have joined us here tonight, we do have a special offer just for you for tuning in. So for those of you that are here tonight, you will be getting off 10% off our Immune IV. This is going to be specifically for our existing patients. Just, anytime that you want to schedule your Immune IV or your nutrient IV therapy with us, just give us a call and give our girls these discount code, which is Immune0301. So that's the day to day. It's going to be valid until May 1st, 2023. If you are not an existing patient, though, and you do want to take advantage of this offer that we have, that's definitely for you too. We do need you to establish care first with one of our doctors. So you can just give us a call, ask us, that you want to let us know that you want to have a consultation for an IV therapy, and then we will set you up with one of our doctors. It's usually pretty quick, about a 20 to 30-minute consult. We do require blood work, specifically your current CBC as well as your CMP. If you already have it with you and if it's been within the last 6 months, definitely bring that into your consult if you want to, speed the process along with getting our IV therapy. And then one of our doctors will go over that, and then they will suggest which IV therapy will be good, most beneficial for you. And so our phone number is going to be right here. That's going to be 760-385-8683. Or you can also email us at hello@solseri.com. So these are for people who, if you're not an established patient yet and you want to get an IV therapy here, are more than welcome to do so. You'll just need to have a quick consultation with one of our doctors and just make sure to bring in your current CBC and CMP. All right. And then, so your body loves you, love it back. Thank you everyone for tuning in today. So do we have any questions?
I'm not seeing any questions in the Q&A. By all means, if anybody has any, please pop them in there. We're happy to answer them. Mira, thank you so much. You're so full of wisdom and great information. And I'm ready to sign up for my IV. Can I go over there and get one from you? So Heather has a question about the cost. So cost is, I don't even know. Do you know the cost?
Well, for our IV, there's like two different costs. One will come with a glutathione push. That one is usually $345 with a glutathione push. But if you decide that you don't want the push and you just want to get the regular bag, I want to say it's $295.
And then aluminum with the B6. Can you explain that, Heather? There's B6 in the IVs that we do, and no aluminum. Aluminum's a heavy metal, so we wouldn't add that to the IVs. I'm not sure if your question is like, does B6 help you to detoxify aluminum, or have you heard that there's aluminum contaminating the B6? I'm just not sure what exactly is going on there. So maybe if you could clarify, that would be super helpful. And then Mary, we do not offer ozone therapy at this time. I refer to Dr. Heather Vlopp is up the street at Synergy 03. They do ozone, and then as does Dr. Kaplan, I think is his name, and he's down on the 101 in Encinitas. So close by our offices, there's a couple people we refer to. He's a naturopathic doctor, super smart Dr. Kalaman, K-L-A-M-A-N. He's close by. I can send you a link or give you a card of his. I trust them both. Dr. Vlopp, she's an MD. Dr. Kalaman, he's an ND, right nearby, easy to find. Oh, awesome. Glad you were able to find them. So Heather had read that injectable pyridoxine always contains some amount of aluminum. I hadn't heard that. Thank you for letting us know. We will look into that. We can both talk to both of our networks, I think, because Mira's well networked in the IV nurse community, and I know a lot of the naturopaths giving IVs. So I'll certainly look into that. We measure aluminum, we measure heavy metals in our patients, and I don't tend to see that go up. Now, we don't give huge amounts of B6 on its own, so I'm not sure if maybe that's why, but we sometimes will do a little bit. So I haven't run into that, but we'll look into it. Thank you for bringing that up. Any other questions before we sign off tonight? We so appreciate everyone who attended. And as always, we're here to answer your questions. So please shoot us an email at hello@Solsere or give us a call at 760-385-8683. We can't wait to see you here in the clinic. Thanks for joining us. Good night.
Good night.